Good afternoon and welcome to the Monday, August 16th meeting of the Health and Human Services Committee. It is 1 o'clock and I'd like to welcome everyone. Are there any changes to the agenda? Okay. We have at least one resolution to add to our agenda today, and there might be another one to follow. So I just want to keep that open. If I could have a mover to add to the agenda resolution 10314, appropriation from contingent fund to the Human Services Coalition for a continuum strategic action plan. Moved by Henry, seconded by Amanda. Sorry, Leslie, I didn't see your hand. It blended in with your it's camouflage. And is there any discussion on that? I see none. All those in favor? That is approved. And that will be added to our agenda. And we will do it right before departmental updates. Any other changes to the agenda? I believe Lisa is working on a resolution right now. And it will be a budget adjustment for public health. And since it is last minute, we can talk about it today. Amanda?
An email just came in.
Okay.
From Lisa. So
Okay. And so why don't we move to public comment, and then we'll come back to that resolution and add it to our agenda. We did have one email that we received this morning, and I'm not sure if everyone received it, from Mr. Lynch, Bob Lynch. And I just wanted to read it to committee members here, and we can have a discussion during the chair's report. Dear Legislator Black, I note that the Health and Human Services Committee meets this afternoon. I may not be able to attend. Therefore, I'll write this message hoping it may provide food for thought at today's meeting. Last Wednesday, on the heels of your legislature action the day before, I advanced a resolution that would require town of Enfield employees either to provide proof of vaccination against COVID-19 or else subject themselves to weekly asymptomatic testing. My idea did not go over well. A principal concern raised by Supervisor Stephanie Redmond was cost. Even though perhaps only one employee, a member of our highway department, would need to be tested. Supervisor Redmond feared the weekly testing cost at $300 per week would break the town's budget. We, the Enfield Town Board, tabled further action on the vaccination resolution until September. With Supervisor Redmond's concern in mind, has the county considered furthering public health by underwriting the cost of asymptomatic employee testing by participating municipalities? We, Tompkins County towns, lack the financial resources of county government. Funding testing at the mall-based Cuba Health Systems testing site would help keep our municipal employees and the public they serve safe. Thank you for consideration of this matter, Robert A. Lynch. So I wanted to inform our committee members of that, and we'll open that up for discussion during the chair's report. Also, I do not see anyone here for public comment here in the chambers. Brittany, is there anyone here for public comment on Zoom? We have not received anything. So we will move on from public comment to the chair's report. I want to welcome everyone that's here via Zoom and open up the conversation. I know that typically for these Health and Human Services meetings, have department heads that are here for 2 hours once a month. And I know while we are back at it again for Zoom or with COVID, dealing with COVID, I really don't want to take your time. It is very valued at this point and very important. And so I want to make sure that all of our department heads know that the Health and Human Services Committee, your attendance is absolutely optional. I don't want you to be bogged down with meetings and feel like this is an essential meeting that you need to attend. The thing that I would ask is that if you have a resolution, if you could please attend the meeting. And if we need to, we can make a block of 10 or 15 minutes and try and keep with that time schedule. If you would like to be here, you are certainly welcome. I don't want to discourage that, but I don't want this to be something that every month you feel like you have to do and you're putting aside other very, very important work. So I wanted to just let everyone know that's on the phone call, and thank you all for your attendance today. I also wanted to let the committee know that we could certainly have a very small COVID-19 update during committee, but I would ask that we not have an extensive conversation, because we are going to get a very extensive update in tomorrow's legislature meeting. And so Frank is back after a 3-week vacation, and this is his first day back. So I'm sure that he has a lot of things to do today. And I know that some of our numbers are some of the highest that we've seen, both with hospitalizations as well as positives. So I don't want to keep Frank for too long. With that said, let's go ahead and talk a little bit about the email we received, and I'd love to see what committee members' opinions are, if you'd like to share. Henry?
Well, this only deals with if the, because right now, we're paying for anybody to go up to the mall to get tested. And so it only deals with if the emergency act by the feds expires in September. And so I don't think that we need to move on this until we hear any other way. And I suspect the feds will extend the emergency act. So I don't see this being an issue, but we can deal with it as it comes.
Well, I think the interesting thing, though, is that if you put on your form that it's for employment, then they will in fact try and go after that employee or the employer. So if, for example, if I'm not vaccinated and Tompkins County requires me to get vaccinated weekly, Hugo Med will go after the person requiring the vaccination. If I'm traveling out of town, if I have symptoms, then your insurance will pay for it. If you don't have insurance, the county will pay for it as a Tompkins County resident. So employment is absolutely separate from what the county is paying for.
No.
Yeah, we're not paying for pre-employment testing. That is up to the employer, or required testing.
Okay, well, then it would be a question of how many employees are we talking about?
Yeah.
And that would also be, I mean, that was the issue that was discussed in our committee, was how much we'd have to pay. It would be $1.5 million over the year. And so I think that would be something that we could bring to the legislature, but I think would be a big concern.
Yeah. Amanda?
So what the idea is here that I guess Mr. Lynch is asking is if the county will subsidize towns and municipalities for COVID testing. I mean, from his email, it says, according to him, there's only maybe one employee in Enfield. I guess it would, my question is, well, we have a lot of municipalities. How many would that be? And would other, towns and villages in the city, would they be coming to us to ask the same thing? And even, I guess we have to figure out who can afford it and who can't. And that feels a little bit who can we subsidize? I don't know. It feels a little bit murky to me at the moment. But like Henry said, it's based on the federal decision, right? Which expires at the end of the month, is that correct? The emergency order?
Yeah, I guess it expires mid-September, or sometime in September. It could expire.
Okay, Amy probably knows.
Yeah, if I can go, Shauna, I can.
Yeah.
All right. So up until this point, the free county testing is not for surveillance testing of any employers. We have had these discussions with some of the municipalities, as well as school districts, as well as private businesses and nonprofits. We have had all of those agencies come forward and ask for us to provide surveillance testing at one point or another. It is for, people that feel that they need it because of an exposure or something else. So we have not made that that jump at this point. And I think that's the piece that if the legislature were to go in that direction, we would have to explore it. You're right, the federal executive order goes through September 30th, although it is sounding like that executive order will be extended. So we do receive FEMA reimbursement for community testing. However, when we start talking about employer mandated testing, I don't know all of the ins and outs of that. We can look at that if that's something that the legislature wants to look at and how that relates either to FEMA reimbursement or what kinds of costs that would be.
Thank you, Amy. Leslie?
Thank you. I think it would be important, if we have the month of September to figure this out, if the legislature deems that this is something we're interested in, at least for our local municipalities, a couple of thoughts. One, we need kind of a census of information, the data for their head count. This is the same thing we need for Tompkins County to understand how we're going to move forward with testing. So we would need to understand the level of testing, to both Amanda and Henry's points, which people have about a month to figure that out right now. And we would need to determine whether or not, say, ARPA funds that come to each individual municipality as well as the county would be something that should be used for this function. And then, we'd want to wonder if it's going to be a limit on employer testing to municipalities, or to Amy's point, knowing that other folks have come forward, what our level of interest, capacity, and how far we would consider extending that. So I think we need to get some data.
Yes, I absolutely agree. I think my concern is that administration, the health department, is already overloaded. And I'm not sure I want to put that burden on them. I do agree also that towns, cities have received quite a bit of funding for ARPA funding. And this is a perfect use of those funds. And it really, this is more or less Pandora's box, with municipalities, nonprofits, academia. Like, it could really be a massive expense. And so what I'm hearing from this committee is that we can certainly ask for some more data, maybe some loose figures of what that would look like for municipalities. And, then maybe we have another conversation in our next meeting in HHS, just so that we get some figures and we can make a decision from there. Amanda?
Yeah, I guess the more I think about this, the more I feel like, something that we talked about for our employees is if the employee who's refusing to get tested or refusing to get vaccinated, they should have pay the cost of this. And I guess I feel like that's something that municipalities should have to consider as well. Like, instead of coming to us, why don't they maybe think about if they should require their employees to pay for it if they're refusing to get vaccinated? So I don't know, I'm reluctant to go down this path or even ask our staff to spend a lot of time on this.
Yeah.
But that's
Henry?
Yeah, I guess you can maybe ask our staff like Amy whether she could follow up with the checking into whether or not FEMA would reimburse the staff costs for that. But I don't think we should. Well, I think we should do that first.
Okay.
And then maybe do a survey. I'm not sure, because if we ask people, how many people would cover, they say, okay, we've got lots of people we need to be covered. And right now it's only one party asking. So I'm not sure we should go down that road just yet. See, but
Amy, do you mind reaching out and just getting the answer from FEMA and seeing if they would be able to reimburse for that expense?
Yes, as long as I understand what the scope of what you're talking about. Is it only municipal bodies? Is it municipal and municipal partners, nonprofits, for-profits? I just need to know the scope, because all of them have asked for this at some point.
Let's go ahead and cast the net broad and see see who might be covered under that. That way we have the answers for all, and we don't have to send you back in another month asking for the other options.
Okay.
And then next month at HHS, we will pick up the conversation based on your information and move forward with the conversation. Does that sound good?
It sounds good, Shauna. The other thing I would encourage you to think about too is capacity for doing this.
Right.
Because that could be, it does open a bit of a Pandora's box, the more people that are mandating testing and how we're going to do that. And if we're paying for that, what does that capacity look like for Cuba Health System? So I think it's a bigger conversation. I'll definitely check into the FEMA side of things, but next month we can probably prepare something a little bit more to help you inform this decision.
Great. Thank you very much. Ann Corman, I see your hand is up.
Yeah, thank you, Shauna. Just want to talk about briefly what Amanda said as far as getting folks, people who are not vaccinated to pay for testing. And I believe we went through that at a meeting while Amanda was away, and I think we determined that you can't mandate employees to pay for testing. Does anybody remember that?
Yes, I think there was a legal issue and it would open municipalities up to a potential lawsuit.
Right.
So we definitely do not want that.
That's all I want to bring up. Thank you.
Thanks, Annie, for the reminder. Any other questions or comments? Okay, that is going to be it for my chair's report. Lisa Holmes, Amy is here for administration. Hi, Amy.
Hi. So Lisa is in the midst of budget, as you guys can all imagine. So as far as updates outside of COVID, I will say COVID, Frank will talk more about this, but Frank, Jay, Dom, and I are going to get back together and be working more closely in the coming weeks. So the EOC will move back from being virtual to being back in person for some time. I don't know what that looks like. The other things is we do have 2 resolutions, one that came in a few minutes ago and one that came after the agenda packet. So the one that just came in to all of you is what's called the rollover resolution that comes in each year using unspent funding from 2020. And this is asking permission to use it in current year. So there is that resolution. And then the other resolution is related to the continuum of care and a strategic planning initiative that the continuum, as well as the city and county would like to undertake. So we have both of those things and a few updates because we are in the midst of budget and all the other things here.
Okay, thank you. And I just want to get a temperature of what everyone is thinking in regards to this resolution. It is for $500,000 and we just received it. And so if we would like more time to look this over and perhaps consider it, we could do, I don't know if we could do a special committee meeting tomorrow after people, nope, we can't do that. But we could put it on the floor today, have a conversation around it. And then if we feel comfortable, we could vote on it. If not, we could postpone it till the next meeting. Kathy?
I just wanted to say that you are required to have at least 48 hours notice for holding a special meeting.
Oh, well, thank you. Okay. Amanda?
I would move to add this resolution to the agenda.
Thank you. If I could have a second, seconded by Henry. Any questions or comments? I see none. All those in favor?
In favor of adding?
Adding it to the agenda. Yes, that's unanimous. Thank you all. So that is going to be added as well as the other resolution. And let's see here. Why don't we add those to the health department? Since both of those are human services. Would you like to continue with your update, Amy?
No, just so you know, the other one you might want to add to Human Services Coalition, the Continuum of Care one. is Human Services Coalition, not Health Department.
Okay. Okay,
I'm all set. I will let you continue on.
okay, thank you. Okay, on to the health department. Frank Krupa, welcome back from vacation.
Thank you. You got, yeah, I see that. Yeah, I didn't exactly get the store back in the same shape that I left it though. So I've been talking with Amy about that. Thank you. No, thank you. It was a great break. I'm so thankful to the team here. We're able to carry on and allow me to take that time. It was great to be with the family and have a little bit of relaxing time.
Did you want to give us a very brief update? We mentioned earlier that we'll have a very brief update here in HHS, and then tomorrow we'll do a big update that I would expect will go on for many hours and exhaust all of us.
Yeah, I mean, I think I'll defer most everything till tomorrow. I think folks have seen, the numbers have gone up. We've seen some hospitalizations, primarily of unvaccinated individuals. We're going to be doing quite a bit of messaging, I think, over the next week or so. Amy referenced the EOC getting back together. We're going to be here at the health department because we want to, there's quite a bit of communication, I think, that needs to go out. And so we're going to be working on getting that out over the next week or so. But we'll have a broader, more comprehensive report for you guys for tomorrow.
Great, thank you. And I see you have one resolution acceptance of the New York State Community Development Block Grant, CDBG, and budget adjustment, Health Department ID 10310, moved by Leslie, seconded by Amanda. And is there any conversation or comments or questions for Frank? Frank, there was one question. Can you tell us how much housing was actually available through this grant?
How much what? I'm sorry, Shauna.
How much housing?
Housing?
Yes. I'm sorry.
This is a septic system replacement program.
How many, sorry, Martha asked a question the other day and I wanted to make sure that it got in today. I misunderstood the question clearly.
Okay.
Is it the number of, oh, I'm sorry, go ahead, Martha.
Yeah, how many housing units, how many homes can be held? 700,000 or so?
Yeah, Liz is here. Liz Cameron, our environmental health director. I'll let her field that.
Welcome back, Frank.
Yeah.
So this grant, we are estimating that we will be able to put in 51 replacement sewage systems. Is that what you're asking, Martha?
Yeah, thank you.
Okay.
And then the 100 or so, I don't have in front of me that the 180 or whatever, is that for the staffing to make this happen?
Oh, the 153 for that's professional service fees. Is that what you're talking?
Right.
Yes, there are two aspects of the grant. This is a very bureaucratic or administrative heavy grant. Planning has done these before. This is our first one, and it's been an experience reading through everything. But you can allocate a certain percentage of your grant to administration. We will actually, and some of that is field work. The administration is doing like visits and seeing who qualifies and stuff. We will be hiring a consultant to administer a large the grant, most of it. We might keep a few pieces. And so that's what most of that money will go for. In fact, that's what all of that money would go for. We're not charging for any of our services. So that would be for the, you have to do a full environmental review and a number of other activities, as well as just all of the documentation and all the stuff Brenda Crosby is dealing with in terms of trying to get everything set up and the right signatures and that type of thing.
Okay, great. Thank you very much. That was my question.
Yeah, as well as like income eligibility, right? They'll be doing all of that part of the applicants, is determining who meets the income eligibility requirements.
That's great. 51 is a great number. That's good.
Are there any other questions? Leslie?
Hi, Liz. Quick question. Are any of these septics, have you already located the septic? Do you have ideas of which households will be helped? I know there's a long list that's existed over time for looking at aging septic systems.
So in order to, one of the requirements of the grant application was we had to have a waiting list of potentially eligible properties. So we put out a survey prior to the grant, and I forget how many we got, but we have a waiting list that's 3 or 4 times higher than the number of systems we have funds to put in. So we certainly have those people on the list. That doesn't mean that there won't, we'll be prioritizing, there'll be outreach. So we don't know exactly which systems will be done. We cannot give the funds to anything that has already been, had funds expended on it. So no current systems will be eligible for this funding.
Okay, thank you. One other question would be, within the last 10 years, one of the priorities was to replace septic systems on the lake, and particularly thinking about water quality, obviously, with placement of septic. Will that be part of a criteria for selecting how to, which properties will get intervention?
This is more of there is a public health hazard evaluation for the systems. There is not, this is more socioeconomic oriented and not toward the lake itself. We do have the state septic system replacement fund that covers 50% of the cost of replacement systems on the lake. So we have those funds available for lakefront properties. I don't think that this fund, the current fund, would be used for any of those properties. We still have a lot of funds available in the state septic system replacement fund that does fund lakefront property replacements.
Great, thank you.
Any other questions, Mike?
The lakefront property, it doesn't just have to be lakefront, does it? I thought it could be like on a creek or a tributary that goes into within a certain distance of those. Is that not the case?
It is supposed to be within 250 feet. The sewage system is supposed to be within 250 feet of the priority water body, which is Cayuga Lake. So there might be some situations where we can go beyond that if we can show that that like a house on a creek, would have a direct impact on the lake. But it's a gray area at this point, and we have not gotten specific approval or requested any expansion or clarification in that area. It's very hard to like what we would do that DEC and the EFC would approve. That also wouldn't just like open it up to almost every system, right? Because there's a lot of systems that are within 250 feet of a creek or something.
Right. Okay.
But it's something we are looking at, that state septic system replacement fund. We're into round 2 of it, the next 5-year cycle. And when we get some breathing room, it's on the list to determine whether we want to look at trying to get DEC and EFC to agree to an expansion of that definition of 250 feet.
Right.
And impacting the water body.
Thank you.
Thanks.
Next is Henry.
Yes, Liz, you said that the priority system is based on income, so it's basically lowest income first.
It's not, there's a variety of factors. There's income, but there's also the public health hazard aspect of it. So if a system, I think you do have to qualify, you have to be low to moderate income. And I forget that definition. It was on our survey, but I forget exactly what that is. But so you would have to meet the minimum definition, but then after that, there'll be other factors that determine who might get it. There also, we're supposed to, I think, give a certain number to frail elderly and possibly a certain number to disabled. So we're trying to work through how all of that, coming up with that criteria list is one of the things we'll be finalizing with the consultant when we hire one.
Thank you, Liz. Any other questions? Okay, let's vote. All those in favor for resolution 10310, raise your hand, please. That's unanimous. Thank you very much, Liz and Frank. And now it's time to talk about what is going on with marijuana legalization. Frank, it's back to you.
Sure, thanks. So not a lot, actually. We did reach out to our governor's reps to get an update, and essentially what they've told us is that because the governor and the legislature didn't come to an agreement on the control board membership before the session ended, it's really kind of stalled most of the effort, because that control board is the group that will be dealing with the regulatory environment for marijuana legalization. And so what we heard from our governor's rep, and this was our soon to be former governor's rep, was that it will be early next year, 2022, before applications would be available for dispensaries, and that it would be likely late spring, early summer of 2022. Actually, I'm sorry, he said fall of 2022 before anything would be opening. So right now everything's kind of in a holding pattern because that control board is not in place. They are doing some of the bureaucratic work behind the scenes to build the cannabis management, I think is what it's called. I'm sorry, I'm just the Office of Cannabis Management. They're doing some of that work behind the scenes to build that office, but really the control board is the organization that's going to be doing the heavy lifting around the regulations. The one thing that they did suggest that local municipalities could be looking at is their outdoor spaces, and whether or not they want to prohibit marijuana use in those outdoor spaces. So I asked our health promotions folks to take a look at what we might do. We've shared some of that, I think, with Shauna as kind of an introductory step, and we'll be looking to bring anything forward as we evaluate that further.
Thank you, Frank. Henry?
Yes, Frank, I know that they had talked about the dispensaries opening up and also the homegrown in 18 months after the bill passed. And so they're now talking a delay in the dispensaries. Also talking about delay in the homegrown aspect of it.
Yeah, I believe anything that has a regulatory component to it is going to be delayed until that control board is put in place.
Okay, also, when you talk about the air quality, is that a county function? Can the county limit the smoking outside?
Yeah, so we do have the ability to have outdoor ordinances. I believe the city has one, and we might actually have one too, for places like parks and those kinds of locations where you wouldn't want tobacco smoking occurring, and therefore, subsequently wouldn't want marijuana smoking happening either. So yes, we do have the ability to do that. We also have our own Clean Indoor Air Act. It basically mirrors the state Clean Indoor Air Act, but we are looking at that as well to make sure that we update that appropriately with some new language.
Okay, and have you followed track of which communities have talked about banning cannabis?
No, unfortunately, attention's been in other places, so I don't have a lot of insight on what other municipalities are considering.
Henry, you can't plant your seeds yet. Martha?
Hi, Frank. I thought I remembered, even though there's this delay in the control board, et cetera, I thought I remembered that municipalities have until maybe the end of this calendar year, if they want to opt out and say that we won't have dispensaries in our locality. Do I remember that right? Is there a deadline?
I don't know the deadline. I'll have to look that up for you, Martha. I don't know that answer.
The deadline's the end of the year.
Well,
The deadline is the end of the year. We say,
like if the town of Dryden says, we don't want any dispensaries in the town of Dryden, they have to do it before the end of the year.
yes.
Thank you. Thanks very much.
Okay, any other questions for Frank? Sounds like there's not a whole lot of movement. Okay. Thank you, Frank, for joining us today. And let's move on to the Office for the Aging. There's a resolution. Budget adjustment, Tompkins County Office for the Aging American Rescue Plan 2021 purchase authorization ID 10270. If I could have a mover, please. Moved by Leslie. I could have a seconder, seconded by Amanda. And Lisa Monroe.
Yeah, I'm here. I'm the deputy at the Office for the Aging. Lisa is on vacation.
Hey.
Hey.
Welcome to HHS.
Thank you.
Would you like to tell us a little bit about the resolution coming forward?
Yeah, sure. So we received these funds through the State Office for the Aging, and we are looking to get a 84-inch, I believe, touchscreen TV for our back room. One of the impetuses for this was to allow our advisory committee to meet in a hybrid fashion. We do have one in our front smaller conference room. However, the room is a bit smaller, so it doesn't allow for social distancing for members who are choosing to come in person. So we are looking to put this in the large room in the back of our building. That way other county departments who utilize that backspace could also use the TV. Right now it's also being used, the room is also being used by grand jury as well as veteran services. So that's the plan for the TV.
Thank you. I have to admit, whenever I first heard your sentence, I thought you said the 84-inch TV will go in the bathroom.
Oh,
I'm really excited about that.
yeah, that might be fun.
Nice, yeah. Any other questions, Henry?
Yes, I was on the grand jury and I know they already have a TV screen in there. Is this just to supplement that?
No, well, it could be. It could be however the grand jury chose to use it. This is one of the larger, it's much larger. It's the touch screen, computer based, so that we could do Zoom meetings and things like that. I'm not sure that TV that they have there has that capacity, but again, that's grand jury, so I'm not sure what they're using it for.
Okay, thank you.
Sure.
Any other questions? I don't see any. All those in favor, please raise your hand. That's unanimous. Thank you very much for coming to our meeting. Do you have any updates for Office of Aging?
I really don't have any major updates today for you.
Great, thank you.
Thank you.
Okay, we have some, let's see here. We have some appointments to advisory boards. The Human Rights Commission, Lisa Christian, Commissioner, term expires December 31st, 2022. And Anna Jett Brown, Commissioner, term expires December 31st, 2022. If I can have a mover, please. Moved by Leslie, seconded by Amanda. Are there any comments or questions? Henry?
How many commissioners is this replacing 2 openings? How many openings are there on there?
Leslie is on there, the liaison. Do you happen to know, Leslie?
I should know that answer. I think these are existing vacancies, so I know that the Human Rights Commission has been eager for this to come in front of us, but I don't have the total head count. I can get it.
Thanks.
Any other questions? Okay, all those in favor? That's unanimous. Welcome to the Human Rights Commission, Lisa and Anna. How do you say that? Leslie, do you know? Anna. Okay. Okay. Moving on, we have some minutes to approve. Minutes for July 20th, 2021. Moved by Amanda. We have a seconder, seconded by Henry. Any questions or comments or changes? I see none. All those in favor? That's unanimous. Thank you. Now let's go back to the resolutions. The first one that we will look at that was added to our agenda is Resolution 10314, appropriation from the contingent fund to the Human Services Coalition for a continuum of care strategic action plan. And if I could have a mover to get it on the floor, moved by Amanda, seconded by Leslie. And Kathy Schlotter is here. Welcome, Kathy.
Thank you. Glad to be here.
Would you like to talk to us a little bit about the $10,000 for the Human Services Coalition?
Right. There's a couple things that spurred this. One, we have a lot of data, both which we call HMIS data, which are from our homeless management information system. Agencies have data around homelessness and what the causes of homelessness are, and who we've seen as our chronic homeless. There's also kind of coincided with a lot of funds that are available now, and we suspect will be more available. And so we wanted to take a really, have somebody very professional take a look at this data, say who is homeless, what kind of housing do we need, what are the support services that are going to make this housing successful. Stuff we may have done in-house before, but right now we don't have the capacity to do this. Got together with the COC, and we thought a good idea would be to hire a consultant to really do a deep dive into the data. And then we're looking at doing this in 2 stages now. One is a stage of having somebody who's familiar with the programs, familiar with the causes of homelessness, kind of look into the data. And then once we get a report from them, then take another look at where and how we could build this type of housing. So the first group will be looking at the data, looking at what's available out there now, and trying to combine, what pots of money are out there with the type of housing that we would need in this community. So we've been talking to some consultants, and we would like to get this done fairly quickly, which is another reason we divide into 2. So hopefully get this done this fall. Anything else?
Sounds like money well spent. We have Mike Stigler and then Martha, and then Henry.
Kathy, I don't want you to think I'm not for spending. I mean, it's not that much money. It's $10,000. So I don't know how much you're really going to get out of that for 10 grand, but it just seems like that we should have this information at this point, I guess. I mean, we've done an awful lot of studies, the housing, I don't know. I guess I'm wondering what are we looking for that's going to be new?
So there's a couple of things. One, this money hopefully will be matched by the city. So the study will be, this first part will be a $20,000 study. And the housing studies we've done before really haven't looked at homeless. That's not the ones done by the planning department. They really didn't look at that population. There is money out there now for everything from shelters to transitional housing to permanent supportive housing. And I don't think we've really done a real look at that before. Like the what was called the Dander study, or the, I may not have that right, but the last one was doing was a little more broader range of housing than we're looking at here.
Okay.
Thanks.
Thank you. And then we'll go Henry, since he's on committee, and then Martha.
No question.
Okay. Martha and then Leslie.
Yeah, that's true. The Dancer study, I mean, there was one subsection of that study, and it's already a few years old, which is always a problem because you're working with 2-year-old data, but it's even older than that. But they did have a subsection looking at the need for supportive housing, as I remember it. And Leslie, were you on staff when this happened, or was it later?
No, but I participated.
Okay, it was, I was on the Continuum of Care Strategic Planning Committee for a while, last year. And yeah, we do a lot of data, but we don't have a lot of analysis, if that makes sense. We have lots of numbers. We don't really have a consolidated analysis that says, this is the log jam, and this is the log jam, and these are the things we need in order to really get people into supportive housing or to really deal with these causes of homelessness. So I really welcome this idea. Amy mentioned it to me a couple of weeks ago, and I think it's really a smart thing to do. So Kathy, you said that you hope part one or both parts will be done by the end of this year.
Well, at least part one. I mean, I'm not as familiar with the builder type people that the planning department works with all the time. People who plan out construction projects and exactly how long that takes. But we know that there is funding out there now. And one of the things is like everybody has ideas about let's build this or let's build this, but we want to do this, intelligently. We want to do it kind of prioritizing our highest needs and, looking at what kind of funding is available. So hopefully we would have some idea by the end of the year about how we could move forward.
Okay, because I know maybe the biggest problem is ongoing support for people who need, it's not just turn an empty hotel into homeless housing. If those
Right.
people actually need supportive services going forward. So,
Right. That's always been the biggest problem there's always been money out to build it. There just wasn't much money out to support it. And that's changing. There is more money out there now. And, we're expecting federal funding to do a lot more in the future. We'll see if that turns out to be true. So we know we have a real, and it's kind of double word, but a population of chronic homeless that is very hard to get in and to maintain in housing. And we really want to see what it would take, what kind of services and support it would take to get people housed and off the street. So.
Thanks, Kathy. Leslie?
Thank you. Kathy, I'm excited to hear about this proposal. I think city partnership is going to be critical. I'd like to understand where what their timeline is for passing a companion resolution.
I don't know. Do you know that, Amy? I think it's pretty soon.
Yeah, this is actually falling through their IURA process, and I don't know the exact timeline, but I believe it's going concurrently, and
Right.
Nels is handling that side of it.
Okay, and the only other thing I'd say to Mike's question about the homeless population, while we do have a chronic issue, it's also fluid and transitional. And understanding that the limited data we may have captured in 2015 in the Danter study is quite dated, and understanding the impacts of COVID on any kind of new homelessness or changing homelessness in the community, we'd want to gather and understand, particularly when it comes to building something physical that can house folks. We may have different ways of thinking about densities that we can house and how. Henry?
Yes, Kathy, you talked about two parts. Is this funding for both parts, or is this only funding for the first part?
It's for the first part, I believe.
Yeah, I think what Kathy we have talked about, so we've been involved, the planning department has been involved in this discussion, as well as DSS, as well as folks from the city of COC. And I think even Jay Franklin made a guest appearance in one of our meetings to talk about properties. This is the first part, then we'll lead into that second part and thinking about developers. The planning department may have more of a lead on that, and there may or may not be a need for additional funding at that phase.
Okay.
Any other questions for Kathy? I see none. Let's go ahead and vote on resolution 10314. All those in favor? That's unanimous. Thank you very much. Kathy, can you also give us an update on ERAP?
Sure. I talked to my staff today, and the big thing that has excited them is they have heard from people who are actually getting funds. It had been a long time coming. So for them, because other people have heard, they're now getting a lot of calls from people who have submitted wanting to know what their status is. So they've been working with people that they call the state, and it takes a while to kind of work through that. They do find that is, if they had a wish, they wish the state would correspond with people who've submitted applications a little better. Like you submit and you'll hear right away, we got your application, then nothing for weeks. I know Kit's on this call, so I don't know if I have the official numbers. I know my group has done about 87 completed applications. Another 25 they referred to the site, helped them with the site. We have another 42 in progress. And so they've been working to help the people who, both tenants and landlords, because I asked that, whether, you know, the people who either don't feel comfortable with computers, get confused, they have, you know, pre-application conversations with them to get all their documentation in. Things have gotten, I don't know that they've gotten easier, but they have gotten a lot of smoother. There were a lot of glitches in the beginning, which has caused a lot of consternation, because I don't know if they had a 30-day window prioritizing a certain low-income population. It took them easily 30 days to get the glitches worked out of that system. So they wish that priority period had been a little longer. Let me see what else I have here. We did do a postcard mailing to about, excuse me, 29,000 people, residents. So there was been a quite a good, I think that was last week, uptake after that mailing of people requesting assistance, which nicely has also upped our request for other programs that we have been able to offer to people. We have both our United Way fund that help people who have small needs, but we also are doing our other, we're doing the ERAP. We have the enterprise program going to help people who are in arrears in the city, and a couple other programs around housing. So we have been able to not just help people with ERAP, but also people who qualify, include other programs that are available now. So that's kind of, our team's been going to court. I don't know if you know, but the Supreme Court just ruled against just personal attestation. You can still do hardship, but you have to, the landlords can take their tenants to court, but then you have to do the hardship attestation in courts. So there are courts. We're finding that there's a lot of misinformation out there, both misinformation on the tenants about like their right to representation, what their rights are under eviction, and also some property managers from some of the larger rental sites possibly do not have the best or clearest grasp of the information and how these programs are running. So we've been trying to get a lot of education materials out also. There are some tenants that, and I would say it's on both sides, tenants that are frustrated because their landlords won't participate, landlords who aren't quite sure about all the rules about what happens if they participate, and landlords who are frustrated that they can't get their tenants to do the documentation they need. So, but I suppose that's to be expected. I don't know if Kit has the numbers, the final numbers that I don't even know today if we're allowed to talk about, but whatever.
Well, we're not allowed to say very much, but I am going to give a quick number. And thank you, Kathy. Thank you for giving a great report, and for also, all the work that you guys are doing at the Human Service Coalition to make this program run. I think that you guys and the folks at 211 have really done a great job. I got my card in the mail yesterday, and I thought it was, I thought it was really well designed. It really kind of, captures your interest when you get it. So I felt really pleased that went out. I think the last report we got from OTDA, we're at about 450 total folks that have applied, not all receiving support through Human Service Coalition, but that are from our county that have applied for ERAP assistance. And as you mentioned, people are finally starting to get some disbursements of the money. I'm hearing that those disbursements are rolling out very slow, that there's still a lot of applications that are being processed very slowly, or that there are glitches, and so they're not able to send stuff out. We had a meeting last week with the state, and they're still running into a lot of bugs with their technical program in terms of receiving the applications, processing them, and then making the disbursements. But I think we're certainly capturing a good number of people from our county. I hope that, like you said, with the mailing going out, hopefully there are other folks that may not be seeing things online that are going to reach out. And I know that the state has also done, they've been really engaging in a campaign to get some information out on television stations, on radio, trying to make that a little more prominent for people as well. So that's probably all we have at this point.
We also know that there are, it's unclear how long it's going to go. We haven't heard any word, they say we're going to cut it off at 200,000 and we're close to like 180,000, but everybody's aware, and they're aware that there are a lot of duplicate applications in the system. People who didn't know if they got in, so they did it again or started it a couple different times or whatever. So I think they're still trying to clean all that up to even figure out how close they are to using up the funds that are available. So
that first month, as you indicated, the system really wasn't working properly. So there were a lot of people that went in multiple times and started the process, and then it would drop them. So I'm hoping that will get cleaned up and we'll get a better sense of what the accurate number is. So
great, thank you very much. Martha, did you have a question?
Thanks, Shauna. Kit, so when OTDA says 450 total applications, are those completed applications? Or could that number be a lot of the duplications or half-started applications you're talking about?
So we're hopeful, Martha, that that number represents the number of completed applications, and that is, so it's a little confusing because when you look at what that actually covers, that covers both people that are applying. I'm actually opening it on my computer again just to kind of glance at it to make sure I get this right. So it's the rent arrears, it's the folks that have applied for rent arrears, the people that have prospective rent that they're asking for help with, as well as the utility arrears that people have applied for. So it's over a couple of categories. So I'm giving a bit of an estimate when it comes to numbers, because what we don't really have a way to know is how many people might have applied for prospective rent as well as utility arrears, but may have also been counted in the rent arrears category. So there may be some crossover there, but we do believe right now that that's a pretty accurate count and doesn't include multiple applications for each person. But I'll be honest with you, I think we don't really know completely. OTDA has sent out multiple iterations of data. They are working with a contracted company that OTDA has been pretty upfront about the fact that they've had some real problems with the way that the data is being tabulated, and I think with some other technical issues. So I am kind of more trusting at this point that those numbers are probably pretty accurate because they've gone through several iterations and made corrections. But I think there could still be more correction coming. I don't know. I don't think we can completely hang our hat on it being 100% accurate.
I hear you. I hear your pain. And what about the eviction moratorium at the state level? Do we know where that stands?
So what I'm hearing through commissioners' meetings is that there has not been any additional stays on the eviction moratorium, that it is set to expire unless somebody has heard something different than what I have. It is set to expire at the end of this month. I was out on vacation last week, and so maybe there's an email that I haven't gotten to yet, but I don't think so. So it is set to expire at the end of this month. I think there could be, considering the COVID numbers increasing, there could be an extension on that, but with all of the transition in Albany, I don't know. I think we are certainly at Social Services right now making preparations for increased challenges at the end of this month and this fall in general, related to that and other changes that are happening. So that's what I know at this point.
Thanks so much, Kim.
Sure.
Any other questions? Okay, I see none. Thank you to both of you for that update. And let's see here, we do have another resolution that is on the floor, or that is not on the floor yet. The new one from administration. Budget adjustment and appropriation of unspent funds for 2020 and prior years to various accounts of the departments that report to the Health and Human Services Committee. If I could have a mover to get this on the floor, please. Moved by Amanda, seconded by Henry. And Amy, would you like to talk to this resolution?
Sure, I won't make Frank start it off since I don't know if he's fully seen this yet, but this is a request for the use of rollover funds. At this time of year, we certify rollover from the previous year and allow departments to ask to use it in current year. So you'll see that the majority of this, or I think all of it actually, is health department related. And there are requests here for the health department to use savings from last year in the current year. And I will have to turn it over to Frank to talk about what they are requesting.
Yeah, thanks, Amy. Yes, this is our rollover request. There is both public health and mental health in this, but all of the rollover is from public health. So this is kind of the beginning of the merger conversation and figuring out how to bring some of our financials together. The bulk of it is for vehicles. We still have 6 vehicles to be replaced in our fleet in order to be fully electrified and to no longer be driving 11 and 12-year-old vehicles around. 2 of them are coming out of the county project, and the other 4 we'd like to purchase with the rollover. We're also looking to put, similar to what Karen Bullis was referring to at COFA, we would like to put the smart boards like you all have there in the legislature chambers in all of our meeting spaces in both buildings, public health and mental health. Public health, I think there are 4 of them for our 4 conference rooms. In mental health, there's maybe 9 or so, and that's because we want them in all of our group rooms. The goal here is to be able to do virtual therapy sessions, both individually, as we're still trying to do social distancing right now, but more long-term, we'd like to be able to have a group setting where some people can participate virtually and others can participate in person and still have that group interaction. So we are looking to outfit our meeting spaces at mental health as well. There's also $10,000 in here for a potential contract with Community Science Institute to create a HABS database. We don't really have a one-stop place where you can go and kind of see all of the information related to HABS, and it's something they've been wanting to do, and we thought was a good use of these one-time dollars. The one thing that might be a little bit confusing is the public health state aid which equals $74,124, is actually revenue that these expenditures would create. So for the public health expenses, we're able to bill 36% of that for state aid reimbursement. So by purchasing all of these pieces of equipment, it would generate $74,000 in state aid to help pay for it.
That's good. I like to hear about the state aid. Are there any questions for Frank on this budget adjustment? Amanda?
Just, I think I understand it all. And I appreciate the explanation. I guess I don't understand why the state aid is in here. Even though it doesn't even make sense as a question, but like, this is about rollover, so why is that in here?
Because we have to put the cost of the items for the budget adjustment. And if we didn't put in the revenue, there wouldn't be enough rollover and there wouldn't be enough revenue to cover the total cost in the budget. This is a budget maneuver to make sure that the budget lines are the appropriate amounts in order to make the purchases.
Okay, all right, I think I get it. And then my other question is, in the resolve, should HHS committee be in that as well? Since we're voting on it?
Yes, that makes sense.
Should.
Okay.
And I'm also glad to see that you're getting some electric vehicles.
So Amanda, would you like to make an amendment?
Sure.
To add HHS committee to the resolve?
Sure, so in the resolve, it would say recommendation of the Health and Human Services Committee and the Budget, Capital, and Personnel Committee.
Great, thank you. Who moved that? Oh, is that Klein? Okay, thank you.
Yeah.
Okay, any other questions? Leslie?
Hi, Frank. Thanks for the update. Quick question about the EVs. Are you all using those right now? Are staff using staff vehicles at the moment, even with the hybrid kind of work environment?
No, we have electric. We have 10 electric vehicles at the health department and 6 that are still remain gas. Obviously, we were not using a lot of vehicles most of last year, but as we've started to transition back to our normal work, staff were beginning to use the county vehicles again.
Just wondering, because I know that some fleets are sitting idle at the moment, so it's helpful to know that they're being utilized. I think the only other question I would have was, it says it's going to budget and capital. Has that already happened, or are we the first committee?
It has not gone through budget.
Okay.
Committee yet.
Henry?
Yeah, that was my question.
Okay. I just want to make sure, are people comfortable voting on this today? If not, we can hold off for next month. Okay, I see some nods. Okay, if there are no other questions, all those in favor? That is unanimous. Thank you, Frank.
Thank you.
And Amy. And let's see here, we can certainly do department updates. Kit, do you have an update for us?
Yes, yep. So we talked about ERAP. That was certainly part of what I was going to talk a little bit about. Where, really where social services is at right now is we are positioning ourselves for fall. We are trying to organize things in such a way that we can help people the best that we can, or try to, with the eviction moratorium going away. We also are having a number of changes related to our regulations and related to kind of changing back to full requirements in the fall. I don't know, considering what the COVID numbers are doing right now, whether or not some of this will be altered, but we do anticipate that full eligibility determinations will be required again in October. in Medicaid, which means a lot of work, a lot of preparatory work for us, because currently throughout COVID, there has been a waiver that districts have not had to do major eligibility determinations, like a 5-year look back when it comes to looking at what income people have and what trusts people have. So there's a lot of work that needs to be done at this point to kind of ready ourselves, make sure that we have some of the other work that has been put aside completed right now, so that if we have to begin those full eligibility determinations in October, we've got the staff time to do it. We're also being told that full face-to-face interviews will commence again in October, which again will really change around the amount of time it takes to do our work, as well as simply being able to manage the work in a new way, or new since the COVID situation has been happening. And then there are some challenges happening right now with some of the audits that have been happening through COVID, but some that were put off, and we're currently kind of swamped in audits. Our Children's Services has 5 audits happening currently, and we're anticipating that on the eligibility side as well. So we're, again, trying to manage that. Have some staff that haven't had a chance to get away on vacation, get away, so that as fall challenges come along, we're ready to deal with those. And we're anticipating that we'll see our homeless numbers increase as they always do in the fall. Our summer homeless numbers have been higher than usual. We've got about 63 people currently utilizing shelter. And we just don't know what the fall will look like. We were hoping to go back to using more congregate sheltering, but that may or may not be advisable considering what's happening. And then, part of what has kept me and administrative folks over here busy recently is just kind of coping with some staff concerns around safety that we've experienced a real increase in incidents around our building this summer, and more recently, a couple of significant incidents. So we're trying to cope with that, and county administration is supporting us with some discussion around that this week. So that's kind of the update for social services.
Thank you, Kit. I did read in the Ithaca Voice what had happened last week, and please extend to your staff that we certainly do support them, and want to make sure that they feel safe at their jobs and walking out to the parking lot. So I know conversations are ongoing, but you certainly do have our support, and let us know what you need.
Thank you so much. I really appreciate it. Thanks.
Anything else from committee members to ask Kit? Does everyone know what happened in the parking lot? There were some people that were shooting paintballs at some of our employees. So there are some conversations that are happening with administration and the employees as well as Kit. And we're just talking about ways to make the workplace safer. Okay, thank you, Kit.
Thank you.
Okay, next up, Kate Shanks Booth. Hello, Kate.
Hello, how are you guys doing today?
I'm all right, how are you?
I'm doing okay. I'm just getting back from vacation, so it was good to get away and come back. There are just a couple things I wanted to let you guys know about. First thing is that one of the exciting things I just wanted to let you know, in October, we're going to be bringing with our rural youth service programs to our youth commissions and our community councils a couple of trainings. We've been working with them in setting goals for 2021 and beyond. One of the things that came out of a lot of those conversations was work around DEI and being able to reach out to those communities of color, youth of color, and make sure that we are doing everything in our power to make sure that we are including everyone. And so we're going to be bringing bringing a training around cultural humility versus cultural competency. And another one in 2 series. So that will be the first, and the second one will be some work around how to write a DEI statement for those commissions and community councils. And so that was really exciting. They're on board for that. And just wanted to say thank you to Megan Lyons, our new staff member who's been leading that charge. Second thing, we were scheduled to have our second community conversation around runaway and homeless youth for this coming Wednesday at 10 a.m. Due to the fact that we want to make sure that we give this very important topic its due. We had our first conversation back on June 7th. We had 40 individuals representing over 20 organizations in Tompkins County who really highlighted for us this crisis for youth. And as you all may remember, the closing of Open Doors, which was run by Family and Children's Services at the end of 2020, really put a dent in some preventive services, especially for those youth ages 11 to 17. And so we had planned on doing this on Wednesday, but due to the fact that August seems to be a very difficult month and we have a lot of our community partners who are out and not able to attend, we are canceling this event and postponing it. The other important piece of that is that we had a conversation last week with the Youth Advisory Board, which was recently put together by Lydia Barger at the Human Services Coalition as part of the application for the federal HUD Youth Homelessness Demonstration Program grant. That grant has been submitted, but they had some interesting feedback for us around youth voice and some perspectives. So we want to step back and make sure that we are allowing them to articulate that and that we're including that in this really important process as we move forward and kind of take a look on the larger scale of homelessness in our community, but particularly as it deals to our runaway and homeless youth for that minor age group. So more to come on that. And that's what I have.
Great, thank you. Any questions for Kate? I see none. Thank you, Kate. J.R. Claiborne. Hi, J.R.
Hello, everybody.
How you doing?
All right, no complaints here. It's Monday. It's Monday, so we've got a new start to the week. Yeah, sorry. Okay, I kind of like Kate. I've been away, so I've been playing catch up. But I do have one thing in particular I would like to share, which is that last week we welcomed the opening of office hours in the here in the Human Services Annex by the New York State Division of Veteran Services. John Canistero, who is the Veterans Benefits Advisor, who has been serving Tompkins County for a number of years now, will now hold office hours here in the Human Services Annex twice a month on the 2nd and 4th Wednesdays. Along with him coming here and offering his services, both helping file claims, as well as help advising our veterans community in the pursuit of their services. He'll also be bringing in the Fresh Connects vouchers, which are similar to the farmers markets vouchers, but these are for our veterans community, and so he'll have those on days that he's here. I also want to take a quick time to say thank you. One of the things with getting John set up is he's, as you heard Karen mention, his office areas in the large conference room of the Human Services Annex, and making that workstation available has been the work of Arel and his crew, particularly Dana, in getting that set up. So it's been really exciting. I'm proud of what they've put together and what they had to offer John, so that he knows he's got a real first-class workstation, and anybody sees that we take offering veteran services quite seriously. Also in that same vein, I want to say thanks to Alana in the clerk's office, as well as RL and ITS. Through working with them, they've helped me set up a form where people who come to the office can request an appointment for services. This is because it's kind of hard to keep up with everybody with one person, but this is going to be able to do this through both hard copies as well as a form that is now set up on portals on our public computers. So I really want to say thank you to all of those folks, because they're really helping us be able to bring veteran services to our community even more so.
Great, thank you, JR. Any questions for JR? I see none. Thank you, JR.
Thank you, everyone.
Reverend Ken? Welcome to HPS. Good to see you.
Okay. Just a couple of brief updates. Hello to everybody. I too, like my other fellow directors, have been on vacation and just returning to the office. Just a couple of things to mention. That OHR is going to be developing a strategic plan to establish our priorities, to look at ways in which we can improve operations and ensure that our staff as well as our stakeholders are working toward common goals and to identify some agreed upon outcomes and look at ways in which we need to position ourselves to respond to this environment that has been altered considerably over the last 2 years by the pandemic. And I will be certainly reaching out to legislative members of this committee for feedback in that regard as we go through this. I see this as something that will be a living document that will be amended and adjusted to meet changing demands, or when we need to make change, when certain practices are no longer relevant to what we do. So we're beginning that process now, and I will be certainly in touch with legislative members, certainly the commission and others as we move forward in that regard. We're working on our program. We've taken a little bit of a hiatus during the summer from the monthly programming we have been doing since last September. And we are preparing to start back up with a program tentatively scheduled for September 16th. I'm working with Richard Rivera of OAR to work on a panel discussion, which is being called Sin Papeles, which in Spanish means no papers. And it will be focused on immigration reform, which is related to the Sin Papeles sort of idea, healthcare, and living wages. We're going to be looking particularly at the way in which these three issues have a particular impact on Latinx communities in our county, and looking at the ways, the challenges that migrant workers in our region are experiencing, many of whom, the majority of which in many cases are of Latinx descent. And so we are working together to organize a panel to address these issues from people who've been working on these issues in our region. And so we'll keep you posted on that, and we'll once we get that panel organized, we will begin to send out word about the event, which is right now scheduled for September 16th. It may change depending on the availability of people. We are also in process of scheduling a meeting with school administrators, teachers, and stakeholders related to this year's Human Rights Arts Competition. We want to get a sense of just what the lay of the land is for teachers and whether it is feasible to go on with our model that we've used in the past, or whether we need to look at alternative ways to engage students from K through 12 around human rights, and to get the best feedback from the teachers and administrators who are working directly with students. And given what all is happening now with this uptick in cases related to the Delta strand, and this extent to which that may or may not alter academic schedules, we are going to take a look at that and determine which way to go forward in this academic year. So those are just a couple of things that we're working on in OHR.
Great, thank you. Any questions for Reverend Ken? Okay. I see none. Is there any other business to be reported by the committee or anyone else on the phone call? I see no hands. Thank you all for attending HHS today. Stay safe and have a great day.